Shoulder pain is a complaint we get a lot in our office, and much of our time is spent figuring out, is the pain actually coming from the shoulder joint itself or the rotator cuff muscles, or could it be coming from somewhere else? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and today I'm going to demonstrate some of the techniques we use if you come to us with a complaint of shoulder pain. Now, of course, we start with a thorough history where we understand where your pain is happening, when it's happening, the quality or type of pain you're experiencing, and then we go to an exam. So we'd look at the shoulder joint itself, that ball and socket, see how it's moving, if there's any pinching or pain in certain movements, if there's any weakness. But we'd also look at the ribs where they attach to the spine near the shoulder blades. Sometimes shoulder pain can actually be coming from the rib cage. And then what can often be confusing is shoulder pain can come from the neck. So we'd examine the neck and see if that is the source of the pain that you're feeling in your shoulder. Once we've determined the source of your pain, we still want to optimize the entire area. Make sure that everything is moving and functioning as best as it can. So Dr. Freedman and I are both trained in a technique called active release technique, which is a type of muscle work where we pin the muscle and then stretch it, so breaking down any tension in any of the muscles. So we'd work, between the shoulder blade and the spine, like this. We'd work on the muscles of the rotator cuff at the back of the shoulder and underneath the shoulder. We'd work on the muscles that attach from that shoulder blade to the neck, making sure they're not causing any pain into the shoulder and that they're tight and moving well. And then we want to work on the muscles of the chest, because if the chest muscles are tight, that can put that arm bone into a pinchy, uncomfortable position that makes the shoulder not move and function as best as it can. So we'd want to make sure that those muscles are nice and open. Next, we would turn our attention to some of the other joints that could be impacting the shoulder, like the joints of the collarbone where they meet the sternum, or even our first rib, which is really up high at the bottom of our neck. So we might use the impulse adjusting tool to make sure that that's moving well. It's just a series of taps that gets motion in there. And we'd also want to make sure that your thoracic spine or your upper back is moving well, so that's not causing dysfunction in your shoulder. We might do a bear hug style adjustment. Or if that's not comfortable for your shoulder to be in that position, then we would have you face down. We could either use the impulse or again use our hands to get that adjustment. Then of course we want to turn our attention to the neck. So we'd make sure that we're working on the muscles of the neck with that active release technique, as well as the joints of the neck, making sure that they're moving well. And here we have a couple options. We can do a traditional cracking style adjustment if that's your preference and your health means that you're a candidate for that. Or we can use the impulse again, where you would be face down and you'd feel a series of taps on your neck. So these are just some of the techniques we might use if you come to us for shoulder pain. Of course, we're going to talk to you about stuff you can do at home, how you can modify your activities of daily living so that you're not in pain and you can speed up your recovery, exercises or stretches you can do to make sure that you get better sooner. And we're going to talk about your work ergonomics and your home ergonomics, making sure there's nothing at home that is making things worse or that you could be doing a little bit better to support your shoulder. Everything's going to look a little different depending on your problem and your condition. If you want to book in with us online, you can book at willowbrookchiropractic.com and we can take a closer look at your specific situation. We post regular content under Willowbrook Chiropractic on YouTube, Facebook, and Instagram. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.